Today we're going to be taking a deep dive
Okay.
into the world of complicated appendicitis.
Okay.
And
Sounds complicated.
you would not believe what I found prepping for this deep dive.
Yeah.
We got 3 research papers here,
Wow.
all about surgical approaches.
Okay.
And the insights are fascinating. We're talking medical innovation, but honestly,
Right.
the takeaways apply to decision-making in any field.
Interesting.
You ready to get a little surgical with it?
Absolutely.
Okay, so picture this.
Okay.
You've got appendicitis, right?
Right.
But it's not a straightforward case.
Mm-hmm.
Things get complicated when a tiny rock-hard lump forms in your appendix.
Oh.
And it's not a pearl, unfortunately. Surgeons call this a fecalith,
Right.
and it can really throw a wrench in the works.
I see.
So a fecalith essentially acts as a roadblock in your appendix,
Okay.
leading to inflammation and infection,
Mm-hmm.
and that's when things get serious.
So that's where our deep dive begins.
Exactly. We're going to explore why removing this fecalith is so critical,
Okay.
and unpack an innovative surgical approach that caught my eye,
Interesting.
the extraperitoneal approach.
Okay.
Now, imagine your appendix is like a ticking time bomb.
Okay.
When it gets inflamed, it can form an abscess,
Yeah.
which is basically a pocket of pus that needs to be drained.
Traditionally, there have been several ways to tackle this,
Okay.
each with its own set of pros and cons.
Right.
The Chang paper we're looking at describes laparotomy,
Okay.
a more traditional approach involving a larger incision in the abdomen.
Oh, wow.
It's effective, but it can mean a longer recovery time.
I see.
Then there's image-guided drainage,
Mm-hmm.
where a needle is used to drain the abscess,
Okay.
but it doesn't always address the root cause,
Ah.
that pesky fecalith.
Right, right.
And then you have laparoscopic surgery,
Yeah.
which is less invasive using small incisions and instruments. But
Right.
as the Chang paper points out, even laparoscopy can get tricky. When there's a lot of inflammation and you've got a free-floating fecalith,
Wow.
it really ups the complexity.
That's a key point.
Yeah.
If there's a free fecalith present, the risk of treatment failure and the likelihood of the appendicitis recurring skyrockets.
You're basically asking for trouble.
Yeah.
It's a ticking time bomb just waiting to cause more issues.
And here's a mind-blowing discovery from the Chang paper.
What's that?
Get this, in some cases with a free fecalith,
Yeah.
the appendix was completely destroyed by the inflammation.
What?
Gone.
Really?
It makes you wonder if in those instances,
Yeah.
a follow-up appendectomy,
Right.
which is usually recommended,
Mm-hmm.
might not even be necessary.
That's a crucial insight.
Yeah.
And it really underscores how important it is to carefully assess each patient's unique situation.
Right.
There's not a one-size-fits-all approach.
Now, to really bring this to life,
Okay.
the Chang paper describes 2 cases,
Interesting.
a 75-year-old woman
Okay.
and a 15-year-old boy,
Wow, big age difference.
both with large abscesses,
Okay.
and you guessed it, free fecaliths.
Oh, boy.
But here's the kicker.
What's that?
The woman's abscess was significantly larger than the boy's.
Really?
It really challenges your assumptions about how age and size might factor into these situations.
That's a great example of why personalized treatment plans are so crucial.
Totally.
It's not just about age or size.
Right.
It's about considering the whole picture.
So how did the surgeons handle these complex cases?
I don't know. How did they?
Enter the extraperitoneal approach.
What is that?
It's like taking a surgical shortcut.
Okay.
Instead of going through the main abdominal cavity,
Right.
they access the abscess and remove the fecalith without entering the peritoneum,
I see.
the space where your intestines live.
So they're avoiding all the important stuff.
Exactly.
That's pretty smart.
Pretty ingenious, right?
Yeah.
The beauty of this approach lies in its simplicity.
I like that.
By avoiding the main abdominal cavity, you significantly reduce the risk of complications, like spreading infection or damaging the intestines.
That makes sense.
It's all about minimizing the invasiveness of the procedure.
It's like choosing the most direct route to solve the problem.
Exactly.
Avoiding any unnecessary detours.
Right.
I like that analogy.
And the Chang paper really emphasizes how this approach is especially valuable in places where resources might be limited.
That's really important.
It's a game changer for delivering quality care in diverse settings.
It really highlights how medical innovation can often mean finding simpler, more accessible solutions
Right.
that can be implemented in a variety of environments.
Absolutely.
It's all about finding the right tool for the job, as they say.
Exactly.
I like that.
Now let's shift gears a bit
Hi.
and talk about another technique highlighted in our sources,
Okay.
the TAPP approach,
TAPP.
which is short for Laparoscopic Transabdominal Pre-Peritoneal.
Wow, that's a mouthful.
This technique is usually associated with hernia repair.
Okay.
But in the Suretis paper, we're looking at it was used in a completely different and unexpected way.
Really?
This is where things get really interesting.
Oh, boy.
The Suretis paper describes a 58-year-old woman
All right.
who was initially misdiagnosed with a strangulated hernia.
Oh.
But when they did a CT scan,
Yeah.
they found something much more complex.
Oh.
Massive abscesses in the extraperitoneal space.
Wow.
And the source,
Yeah.
a completely disintegrated appendix.
What?
It was practically gone with only the base remaining.
So her appendix basically vanished.
Yeah, it's wild.
How is that even possible?
It speaks to the severity of the infection and the delay in diagnosis.
I see.
Her body was essentially fighting a losing battle against this massive infection.
Wow, that's crazy.
So how did they use this TAPP approach to address this incredibly unusual situation?
Yeah, how did they?
The TAPP approach in this instance
Okay.
allowed the surgeons to accomplish two goals simultaneously.
Interesting.
They removed the remaining part of the appendix and drained those extensive extraperitoneal abscesses.
Wow, so they got rid of the problem and cleaned up the mess.
Exactly.
That's efficient.
It's like killing two birds with one stone, surgically speaking.
Makes sense.
Remember how we talked about the extraperitoneal approach, avoiding the main abdominal cavity?
Yeah.
Well, TPP takes a different route,
Okay.
entering through the abdominal wall,
Mm-hmm.
but then carefully navigating behind the peritoneum
Okay.
to reach the abscesses.
So instead of going straight through, they're taking a more roundabout route to get to the problem area.
Right.
That seems kind of counterintuitive.
It might seem that way,
Yeah.
but it's actually quite brilliant.
Okay.
It's a very precise and targeted approach
Gotcha.
that minimizes disruption to the abdominal organs.
I see.
Okay, that makes sense.
Yeah.
And just to highlight how unique this case was,
Yeah.
remember that the Suretis paper mentioned she was initially misdiagnosed with a strangulated hernia.
Oh, yeah. I forgot about that.
It really makes you think about the importance of thorough examination
Mm-hmm.
and accurate interpretation of diagnostic imaging.
Absolutely.
Now I think it's time to bring in our expert
Oh, okay.
to connect the dots between these two approaches.
Okay.
Both the extraperitoneal and the TATP
Right.
seem to prioritize minimally invasive techniques
Yeah.
and put patient well-being front and center.
I agree.
What do you think?
You're absolutely right.
Yeah.
What these approaches demonstrate is a shift in surgical thinking
Okay.
towards less invasive, more targeted interventions.
I see.
It's not about brute force anymore. It's about precision and finesse.
And it's a reminder that there's no one-size-fits-all solution in surgery.
Absolutely not.
The best approach always hinges on the specific circumstances of the patient,
Mm-hmm.
the expertise of the surgical team,
Of course.
and the resources at their disposal.
Right.
It's about making informed decisions
Exactly.
based on a careful evaluation of the situation.
That's a crucial point. The other research articles we've reviewed offer a range of perspectives on managing these complex cases, emphasizing that the ideal approach is often a judgment call.
Okay.
Based on individual patient factors
Right.
and the resources available.
It sounds very case by case.
Exactly.
There's no magic formula.
Nope.
So listeners,
Hey, everyone.
we've covered a lot of ground so far in this deep dive.
Yeah, we have.
We've learned about the crucial role of fecaliths in complicated appendicitis,
Right.
explored the innovative extraperitoneal approach,
Mm.
and delved into the fascinating world of laparoscopic surgery and the TAPP technique.
It's been quite a journey.
But before we move on to the next part of our deep dive,
Okay.
I want to leave you with a thought-provoking question to ponder.
All right.
The Suretis paper mentioned a fascinating detail.
What's that?
Their patient was scheduled for a follow-up colonoscopy to rule out a possible tumor.
Oh, wow.
This raises an interesting question. How does the possibility of a hidden underlying cause change your perspective on medical diagnosis and treatment?
That's a great question.
Just something to think about.
Yeah, it really is.
Food for thought, right?
Definitely.
Join us in the next part of our deep dive as we continue to unpack these ideas and explore the implications of these surgical approaches.
Sounds good.
We'll be back right after this.
See you then. It really does make you think,
It does.
how one seemingly isolated issue
Right.
can actually be a symptom of something much bigger going on beneath the surface.
Exactly. And speaking of looking deeper,
Yeah.
the Chang paper brought up another point
Okay.
that I found fascinating.
What's that?
The role of fecaliths in actually destroying the appendix.
Oh.
It seems the more intense the inflammation,
Uh-huh.
the more likely the appendix will essentially self-destruct,
Yeah,
leaving just a remnant.
that's right. And it really changes how we think about interval appendectomies.
Yeah.
Traditionally, after an abscess is drained, surgeons recommend removing the appendix later to prevent future episodes.
Makes sense.
But if it's already been destroyed by the initial infection,
Yeah.
is that follow-up surgery even necessary?
So it's almost like the body's already taking care of the problem in a way.
Yeah, in a sense.
But of course, that doesn't mean you can just ignore the situation altogether.
Exactly.
Okay.
Careful monitoring and follow-up are still crucial
Right.
to make sure the infection is gone
Well-
and there are no lingering issues.
Speaking of lingering issues,
Yeah.
the Chang paper mentioned something called dropped or retained fecaliths.
Oh, yeah.
What exactly are those?
So it's a potential complication during surgery
Okay.
that can have pretty serious consequences.
Uh-oh.
Imagine this.
Okay.
You've meticulously drained the abscess and removed the main fecalith,
Okay.
but a tiny fragment breaks off
Oh, no.
and gets left behind.
That doesn't sound good at all.
Not good at all.
Oh, gosh.
That tiny piece can act as a seed for a new infection,
Oh.
leading to another abscess.
Ugh.
And as the Chang paper pointed out, removing these hidden embedded fecaliths
Yeah,
can be incredibly challenging.
I bet.
They even cited a study
Oh, really?
where 30 cases of intra-abdominal abscesses
Wow.
were caused by these dropped fecaliths.
Wow. 30 cases.
Yeah.
That really emphasizes how important meticulous surgical technique is in these situations.
Absolutely. Every little detail matters.
Right.
And surgeons need to be incredibly vigilant to prevent these complications.
Okay.
Sometimes advanced imaging techniques are necessary to locate and remove these elusive fragments.
It's almost like a combination of surgical skill,
Yeah,
technology, and a touch of detective work.
that's a great way to put it.
Yeah.
And it reminds us that even with all the advancements in medicine, there's still an element of art and intuition involved in surgery.
Now, going back to the extraperitoneal approach, the Chang paper argues that it's not only effective, but also highly accessible,
Yeah.
making it especially valuable in resource-limited settings.
It's a critical consideration,
Yeah.
especially when we think about global health equity.
Right.
Not every hospital has access to the latest and greatest equipment,
Of course.
but the extraperitoneal approach provides a viable alternative
Right.
that can potentially improve outcomes for patients around the world.
So it's not always about having the fanciest technology.
Yeah, not at all.
Sometimes the most impactful solutions
Yeah.
are the simplest and most adaptable ones.
Precisely. It's about finding elegant solutions that work for the situation.
Now, we've been focusing a lot on the Chang paper,
Yeah.
but let's not forget about the other research articles.
Right.
They offer a valuable perspective on the idea that there isn't just one right way to manage complicated appendicitis.
That's right.
Okay.
The medical literature is full of diverse perspectives and sometimes conflicting opinions,
I can imagine.
and that's a good thing. It forces us to think critically and consider all angles.
Right.
Some studies advocate for laparoscopic techniques, while others highlight the benefits of percutaneous drainage.
Interesting.
Ultimately,
Yeah.
the best approach
Right.
is the one that's tailored to each individual patient,
Right.
taking into account their medical history,
Okay.
the severity of their condition, and the resources available.
So it's not a black and white decision.
No, it's not.
It's more like a puzzle where
Wow.
you have to fit all the pieces together to get the complete picture.
I like that.
And sometimes there might be multiple ways to solve that puzzle.
Absolutely.
And that's where the expertise of the medical team comes in.
Right.
They need to weigh the pros and cons of each approach. Consider the patient's individual circumstances
Yeah.
and make the best decision possible
Right.
based on the evidence and their clinical judgment.
It's a reminder that medicine is both a science and an art, requiring a deep understanding of the human body,
Of course.
a mastery of surgical techniques,
Right.
and a compassionate approach to patient care.
Well said. And it's a testament to skill and dedication
Yeah.
of the surgeons and medical professionals who deal with these complex cases every day.
Definitely.
Let's go back to a point we touched on earlier,
Okay.
the possibility of a hidden underlying cause.
Right.
The Suritis paper mentioned that their patient needed a follow-up colonoscopy to rule out a possible tumor.
Right.
This raises a really interesting question about medical diagnosis and treatment.
Where's that?
We tend to focus on the immediate problem,
Yeah.
the pain, the infection.
Right.
But what if those are just the tip of the iceberg.
It's a crucial reminder that we can't always take things at face value in medicine.
Right.
We need to be curious, ask questions, and consider the possibility that something deeper is going on.
Absolutely.
It's like peeling back the layers of an onion
I like that.
to find the core issue.
It reminds me of the case in the Therapeutic paper.
Yeah.
Where that misdiagnosed hernia turned out to be something much more complex.
Exactly.
Yeah.
It highlights how important it is to have a thorough understanding of each patient's individual circumstances
Right.
and to be open to the unexpected.
Now, shifting gears a bit,
Okay.
there's another fascinating research paper I wanted to discuss.
All right.
This one by Eskelinen and colleagues
Okay.
dives into the use of laparoscopic surgery for treating appendiceal abscesses in children.
Interesting.
It's a different patient population than we've been discussing so far.
Right.
But it raises some really interesting points
Okay.
about the evolution of surgical techniques.
The Eskelinen paper is a great example of how laparoscopic surgery has become increasingly popular,
Okay.
even in complex cases involving children.
Interesting.
They described their experience using laparoscopy to treat appendiceal abscesses
Okay.
in a group of 40 children. What's particularly interesting is their focus on minimizing the invasiveness of the procedure
Right.
while still achieving excellent results.
And they actually compare their laparoscopic approach
Yes,
to the more traditional open surgery, right?
Right.
What did they find?
They found that the laparoscopic approach was associated with shorter hospital stays,
Okay.
less pain medication use,
Wow, that's great.
and faster recovery times compared to open surgery.
So much better for the kids.
Yeah, definitely.
And their families.
Absolutely.
That's really encouraging.
Yeah,
It seems like laparoscopic surgery offers some clear advantages
definitely does.
in terms of patient comfort and recovery.
For sure.
But I'm curious,
Yeah.
did the Eskelinen paper mention any challenges or limitations?
They did,
Yeah.
associated with using laparoscopy in children.
What were they?
They acknowledged that laparoscopic surgery can be more technically demanding,
Okay.
requiring specialized equipment and expertise.
Right.
And in some cases,
Depending on the size and location of the abscess,
right.
it might not be feasible to perform laparoscopically.
I see.
But overall,
Yeah.
they concluded that the benefits outweigh the risks in most cases.
It's like any tool. It
Exactly.
has its strengths and limitations.
Yeah.
It's all about using the right tool for the job
Right.
and having the experience to know when to adjust your approach.
Exactly. Surgical decision-making is all about balancing the potential benefits
Right.
of a procedure
Okay.
with the potential risks,
Mm-hmm.
taking into account the individual patient's circumstances
Right.
and the surgeon's expertise.
So we've got these 3 different research papers,
Yeah.
each highlighting a different aspect of managing complicated appendicitis.
Right.
We've got the Chang paper emphasizing the importance of the extraperitoneal approach, especially in resource-limited settings.
Yeah.
We've got the Therapeutic paper
Yeah.
reminding us to always be on the lookout for hidden underlying causes.
Right.
And we've got the Eskelinen paper.
Demonstrating the growing use of laparoscopic surgery in children.
That's a lot of information.
It is,
Yeah.
but it's all valuable.
What I'm gathering from all of this is that there's no one-size-fits-all approach.
Exactly.
It's all about tailoring the treatment to the individual patient.
Absolutely. The world of surgery is constantly evolving with new techniques and technologies emerging all the time.
Right.
But at the end of the day, it's about using the best tools available to achieve the best possible outcomes for each individual patient.
And speaking of achieving the best possible outcomes,
Yeah.
the Therapeutic paper mentioned that after their patient recovered from surgery, they arranged for a follow-up colonoscopy.
Yes, to rule out a possible tumor.
Right.
It's a fascinating detail.
It is.
And it leads us to a really important question for our listeners to consider.
All right, lay it on us.
How does the possibility of a hidden underlying cause change your perspective on medical diagnosis and treatment? That's a great question.
It's easy to focus on the immediate problem,
Yeah.
the abscess, the pain. But sometimes those symptoms are just a small part of a much bigger picture.
Right.
What lies beneath the surface
Right.
could be something entirely different.
It really makes you think about the complexities of the human body
Definitely.
and the importance of staying curious, asking questions, and advocating for your own health.
Absolutely.
Join us in the next part of our deep dive as we continue to explore these ideas and unpack the implications of these surgical approaches.
Sounds good.
We'll be back right after this.
See you then.
Yeah. It really is a humbling reminder
It is.
that in medicine,
Yeah,
we're often dealing with probabilities, not certainties.
right.
There's always the potential for the unexpected.
Always.
And that's where ongoing observation and reassessment are so crucial.
Yeah, I agree.
We can't just assume we have all the answers.
Exactly, and that's why it's so important for both patients and healthcare providers
Right.
to be lifelong learners.
Totally.
We need to be open to new information, willing to challenge our assumptions,
Right.
and always ready to adapt our approaches
Right.
as we gain new knowledge.
Now let's zoom out for a moment.
Okay.
And think about the bigger picture here.
Right.
This idea of the extraperitoneal approach.
Yeah.
Finding simpler, more accessible solutions to complex problems has implications that go far beyond just the operating room.
You're absolutely right.
I think so.
This principle of resourceful innovation
Right.
applies to so many challenges we face.
It does.
From developing sustainable energy
Right.
to addressing social inequalities.
So many things.
It's about thinking outside the box,
Yeah.
questioning conventional wisdom,
Mhm.
and finding creative ways to achieve our goals with the resources we have.
It's a reminder that sometimes the most groundbreaking innovations
Yeah.
aren't the flashiest or the most expensive.
Right.
They're the ones that meet a real need,
Exactly.
could be adapted to different situations, and have the power to make a difference in people's lives.
And that brings us back
Yeah.
to the heart of what we've been discussing today, the intersection of human ingenuity,
Right.
scientific knowledge, and compassionate care.
It all comes together.
Whether it's developing a new surgical technique
Right.
or advocating for better access to health care, it's about using our collective wisdom and resources
Yeah.
to improve the well-being of individuals and communities.
So as we wrap up this deep dive
Yeah.
into the world of complicated appendicitis and surgical innovation,
It's been quite a journey.
it has.
We've learned a lot.
I want to leave our listeners with one final thought.
Okay, shoot.
We've talked a lot about the importance of removing the fecalith,
Right.
but let's not forget that the fecalith itself
Yeah.
is just a symptom of a bigger issue,
Right.
the inflammation of the appendix.
That's-
And that inflammation can be triggered by a whole host of factors, from blockages and infections to,
All right.
as we've discussed, potential underlying conditions like tumors.
It's like a detective solving a case.
Yeah.
You can't just focus on the immediate evidence.
Right.
You have to investigate the root cause to truly understand what's going on.
So as you go about your day,
Yeah.
I encourage you to remember the things we've learned in this deep dive.
It's good advice.
Stay curious.
Mm-hmm.
Question your assumptions.
Yeah.
Keep seeking knowledge.
Definitely.
And be an advocate for your own health and well-being.
Couldn't have said it better myself.
And if you ever find yourself facing a complex problem, think back to the extraperitoneal approach.
I like that.
Sometimes the simplest, most resourceful solution is the most effective one.
And don't underestimate the power of staying informed
Yeah,
and engaged in your own healthcare journey.
I agree.
The more you know,
Yeah.
the better equipped you are to make informed decisions about your health.
Thanks for joining us on this fascinating exploration.
It's been fun.
Until next time, keep exploring, keep learning,
Yes.
and keep asking questions.
We'll see you next time.